Right now, if the person next to you were to go into cardiac arrest, your first action would most likely be to call 911. That 911 dispatcher would send a medic unit with highly trained paramedic EMTs coming your way. The paramedic EMTs would be able to give the patient treatment and attention a doctor would, but they are going to be getting to you sooner, so the patient has a higher chance of survival. Now, flashback just 45 years ago. The person next to you would not be able to receive the same treatment and would have to wait until they are at the hospital for any kind of advanced life support actions to take place. And for this, we have Gordon Vickery to thank. Gordon Vickery was born in 1920 in the town of Ruthon, Minnesota. In 1943, Gordon joined the Seattle Fire Department as a firefighter. Vickery didn't know it yet, but he was about to change the way our nation handles heart attack patients on the scene. Gordon became chief in 1963 and had plans of talking to Dr. Leonard Cobb to see if his dreams could become a reality. Dr. Leonard Cobb was chief of cardiology at Harborview and had many insights he could give Gordon. These two men were going to form the Medic One program. The Medic One program provides pre-hospital care to the citizens and visitors of King County using firefighters, EMTs, and paramedics. Paramedics are trained by the University of Washington and Harborview Medical Center in advanced life support. Due to their training and their continued education, they can use an extensive array of emergency medication, equipment, and procedures. In 1974, after the Medic One program was featured in a 60 Minutes episode, it was said that Seattle is the best place in the world to have a heart attack. The cardiac survival rate in King County in 2013 is the highest in the country at 62%. I got the opportunity to interview one of Shoreline Fire Department's paramedics, Todd Woolham. How long have you been a paramedic?
8 years now.
Okay. And what was involved with becoming a paramedic and the training of it?
So North Shore Fire and Bothell Fire Department are allowed to test into the Shoreline Fire Department's paramedic program. So it's a promotional test. You study for it, you take a written test, and then take a practical test. And you're placed onto a list of those 2 different tests, and allows you to enter the paramedic training program. And then once you're accepted into paramedic training school, it takes about 10 months. It's down at Harborview. It's all doctor taught. I was going to tell you about it. Spend a lot of time downtown. It's a very intense program. You kind of learn by immersion. You work very long hours, and you go to school during the day and ride Medic 1, Medic 10 at night. You get a lot of training, a lot of hands-on.
Do you do any training in college, or is it just for training to be a firefighter?
There is some college-based aspects to it. They have recently become an accredited program, so you can come out of the program with a 4-year degree for the University of Washington if you follow up and do all your basic education classes at the
Okay, and why do you think the Medic One program is so nationally recognized?
It's a very well run program. It uses a different kind of model as far as the placement of the rigs. They do less paramedics per area than other departments, and so the paramedics that they have are better trained. They run on more calls, they're busier, and we're allowed to do a lot more skills than other places are allowed to do.
Okay, and what are some things paramedics do on a daily basis?
On a daily basis, the bread and butter calls, chest pain call. Taking care of somebody with chest pain, bring them to the hospital, start an IV, a little bit of medicine, get them in to get them taken care of.
Okay, so I'm here at Station 57, Medic 65, and we're going to get a quick tour of the medic unit.
Get a closer look. We've got all kinds of equipment stashed in cupboards on either side. There's stuff under both benches. Over here we have all kinds of drawers. This is mainly our airway stuff. This is all of our IV and medication stuff. We have kits that we take into the house, and this is one of our cardiac monitors. And if you'd like, I can put you on that and show you what that looks like. All right. We do this on most patients. Most patients get the cardiac monitor, especially cardiac patients. This keeps an eye on your heart rate, your oxygen levels. We can take a picture of your heart, see if you've got any kind of heart attack going on. All right. Feeling okay today?
Feeling good, feeling good.
They usually go kind of on your chest here, but for video's sake, we'll just do them on the arms. Keep her covered. Okay, so I'm going to put this on the inside of this arm. And there's 3 of them. We call this a 3-lead. Okay. Your lower leg here. So that'll monitor her heart rate, and you'll see her heart rhythm pop up there on the monitor. Your heart rate is a nice, cool, calm 68. Let's see if the 027. And your oxygen level is 100%.
What do you think the founders of Medic One would say if they saw how the program was being ran today?
I think they would be very excited. It's different than when he started, where we can do more things than when he started, but it's also more under fire than it's ever been just because of the funding model. It's a more expensive program to run than others, so it's under attack all the time.
All right, and the last question is, where do you see the Medic One program in 10 years?
Hopefully staying the course, just like we are right now, with a 2-paramedic system, still not protocol driven, and it is based upon our experience and our what we're thinking is going on with the patient, and we run it by the doc. So hopefully we'll continue with that model and we don't deviate too much.
Gordon Vickery had to take the risky first steps on his own to create this program. Thankfully, Vickery knew his resources and used them very wisely. Gordon also had a game plan and kept a positive attitude through it all. To this day, Medic One is still a very efficient program that is praised upon by many people.